Good afternoon, everyone, and thank you all for being here. Prevent, promote, and protect public health is the mission of South Central Public Health District. To that end, my staff and I have worked day and night to educate and to do everything we can to help prevent COVID infections within our communities and to protect our hospitals from being overwhelmed. Our efforts continue with the dedicated staff that has been inundated in the recent surge of cases across our district. We have done everything. We can educate, to inform, and to recruit help in this pandemic, but it is no longer enough. At this point, I'm making a plea. Help us, do your part. Wear a mask, wash your hands, and watch your distance, and avoid crowded places. Public health will continue to work beside you, but we and hospitals cannot do this without your help. Our Board of Health and I have gathered community leaders with us today to help illustrate the impact of this disease. COVID-19 is not just a bunch of numbers. It is a disease that is costing our communities heavily. Together, we are urging you to help us beat back this disease, save lives, and protect our communities. After all, we all want our community to be healthy, our businesses to stay open, and our kids in schools so that they can learn and thrive. Now I'm going to turn the mic over to Dr. Josh Kern, Vice President of St. Luke's Medical Affairs of Magic Valley region. Dr. Kern.
Yeah, thanks, Melody. This is Dr. Kern. I am just going to kind of give a brief summary of where we're at today. To Melody's point, the purpose of any intervention around coronavirus has been to prevent the hospitals being overwhelmed. And here I am today to say the hospital is being overwhelmed. We had a new record for over 50 patients with COVID in the hospital today. We're setting records for the number of patients our hospitalist service is trying to manage. We transferred out patients again last night, and our ICU is again today on diversion because of not being able to upstaff to the volumes that are needed for the patients. We had 2 more deaths overnight. These kinds of numbers are shocking, and it's the type of thing that we've been trying to beat the drum to prevent in the long run around COVID, and here we are not preventing it. So our plea from St. Luke's is that people take action. The community needs to take action. More alarming maybe is that we're setting records for positive cases over the last couple of days compared to any point in the pandemic, and hospitalizations lag a week to 10 days. So the stark reality is we're still probably a week out from the worst of it, and that assumes that things get better starting today. We still have a ways to go. I think we're all alarmed and frankly kind of scared about what is to come. Overnight last night, we had to change nursing staffing ratios across the house to levels that we wouldn't normally do. And that's not the type of thing that provides optimal care, but we're being overwhelmed with patients, and frankly, there's nowhere to send them at this point. Boise hospitals are very full. Most of the hospitals in this area are experiencing similar issues. Salt Lake area hospitals have full ICUs. There's not really a cavalry to come. We're it. We're going to be here to provide care and try to do the best we can. We're going to continue to look at winding down some services. We'll probably have some announcements over the next day or two about some changes that to more services that we have to walk back and not be able to provide at the hospital to try to maintain a safe patient care in the hospital. Those are my comments for today, and I'm passing over to Ben Smalley.
Thanks, Josh. So I wish to express appreciation to everyone who has worked so hard during this pandemic to help protect others and to wear a mask and to distance and to strive to help curb the rise of this disease. Intermountain Healthcare is the organization that we're part of. And what they did early on this pandemic, they sent 100 caregivers to New York City when they were experiencing their spike. And they learned a lot from that experience and from going over there. And one of the things that New York shared with them is that it was not a slow trajectory of increase in cases. It was almost like overnight they were just overwhelmed and slammed with the number of patients who needed support and care. And that's one of my concerns, is that we've reached this point now where we're nearing capacity and we have several patients admitted at Caregiver Regional who have COVID. About 50% of the patients that we have here are positive for COVID, which is the highest that it has ever been. And I'm just worried that it's only going to take 1 day or 2 days, or all of a sudden we're going to see this huge influx and we're going to be overwhelmed quickly. And I worry about the patients that need support and making sure they have a place to go. And then I also worry about our caregivers who so desperately want to take great care of their patients. And we're finding that among our own ranks of caregivers that they're also being tested. They're going home to family members who are possibly have been exposed out in the community. We're not finding them getting the virus or being positive from in the hospital, because in the hospital we have really strict protocols and mask wearing and things, but our caregivers are starting to get tired, and we're talking about extra shifts and ways that we can continue to accommodate the influx of patients. Dr. Kern mentioned Salt Lake, and that's where many Intermountain hospitals are, obviously, and they've opened up 2 units just this week, additional valves to try and accommodate more patients. And so things that we've talked about, read about, heard about in other places is starting to come to fruition here in our area. And so just appreciate efforts and a willingness to do the things that we think will have the biggest impact on helping to slow the spread. I just wanted to end by sharing just one experience. So one of our caregivers had a close relative pass away from COVID-19, and that individual was 65 years old. And it makes me sad to think of a 65-year-old a grandpa not being able to enjoy time with grandkids and going on trips and all the things that he has worked so hard to be able to do in the latter part of his life. And when I hear comments like this is a disease for folks who are really old or are already really sick, it just makes me sad to hear that, because it is affecting definitely folks with multiple conditions, but also many people who have a lot to give and a lot of life left, and it is unnecessary in a lot of ways. And so just continue to hope and express my appreciation for those who are willing to help curb the spread, and it will make a big difference here at Caregiver Regional. So with that, I understand that someone has a statement from Tom Murphy at Minidoka.
Thank you so much. This is Brianna Bodley. I'm just reading off a statement from Tom. He was unable to join us today, which is why I will be reading the statement for him. He says, Minidoka Memorial Hospital is very grateful to the staff of South Central Public Health District and all they do to support the health and well-being of our community. They have been very resourceful to our hospital. We support the status change from orange to red for our county based on the influx and severity of COVID cases we are seeing at our facility. We call on the board of South Central Public Health District to consider more action than the current recommendations to help slow the spread of this pandemic, as our organization is already overwhelmed with the volumes that the COVID-19 virus is creating. That is the entirety of his statement that he sent to me. Again, this is Tom Murphy. He is the CEO of Minidoka Memorial Hospital and was unable to be here with us today, but wanted to show his support and unification with the rest of us. Now, I will pass the time over to Linda Montgomery. She is our chair of the South Central Public Board of Health.
Thank you, Brianna. Just for a little background, I have served on the local Board of Health for the past 26 years, working to help our community stay healthy. This pandemic has presented unique challenges throughout our entire state, And I join with these community partners to ask that our residents help us fight COVID-19. In the meantime, the board will continue to meet and virtually and to support the decisions that will help protect our community. In August, the South Central District Board of Health issued a resolution strongly encouraging the use of face masks when social distancing was not an option. We continue to urge the public to use face masks in addition to sanitizing surfaces, washing your hands often and with warm water, and most importantly, stay home if you do not feel well. At the board meeting yesterday, South Central Public Health District Board took a step forward. We are sending a letter to Governor Little encouraging him to put the entire state of Idaho under a mask mandate. We are a mobile society, as can be proven by the counties here. We travel the bridge back and forth to Twin Falls. We go to Burley. It isn't a one county issue. We are a mobile society. That's weather approaching, getting colder, and more time being spent indoors. It's more and more important that people follow the recommendations of the health district as well as the CDC and wearing masks in close quarters if social distancing is not available. As our county numbers set new records daily for confirmed cases of COVID-19, the board also voted to restrict the size of gatherings. This has been proven as one way of deterring the spread of the virus. The information on the board's recommendation and our current matrix is available on our health district website, which is phd5.idaho.gov. Along with other information on this website is included the number for our COVID hotline that's available Monday through Friday in English and in Spanish, as long as other information that is available from businesses, community leaders, or even individuals to print out and use. They are also available in English and Spanish. It is very important that we all need to take this virus seriously and we continue to help stop the spread so our businesses and our schools can remain open. Stay safe, sanitize, wear masks, so we can all help to stop the spread of this COVID-19. This time, it's my pleasure to introduce Suzanne Hawkins, Mayor of Twin Falls City. Welcome, Mayor.
Thank you, and thank you for the invitation to be part of this team today. I really appreciate it. Quickly, I'm going to go down two separate directions. As Mayor of the City of Twin Falls, I really have two major obligations. One is to the organization itself of the city and our employees, and the second is to our citizens and those that we have been elected to serve and to make the tough decisions for. We've been trying to balance this carefully as we have been learning. As others on this call, we are not medical professionals. We have been trying to gather information and make decisions in a quick but safe manner without knee-jerk reactions and putting on restraints that maybe don't make sense and just frustrate people even more so. So as far as the city, when COVID was first released, we did put the city buildings on a lockdown on a employee-only basis, and then slowly started reintroducing the public. With the decisions today to move the county to a red level, I am sure we're going to be readdressing what foot traffic is allowed on city properties and in city buildings again shortly. It is something that the entire council will need to discuss together, as of no one of us can make a decision without the group. To date, about 3% of an annual property tax bill has been spent on COVID. There is going to be an ongoing expense to the citizens as well as employees if we don't find a way to get this virus under control. And now it is progressing to a point where it's going to affect pocketbooks as well as life. Sad fact that people sometimes listen to money more readily. One of the things we've also seen is a very split in our community as to what people want to believe. And it's my plea that folks will please really research this out. Nobody has all of the answers. We're doing our best to work through this. We've seen other communities slow the spread by wearing masks, by staying home when they're sick, by washing your hands, by distancing when at all possible. There's rough choices to be made. There's sacrifices to be made. We've all had events and special gatherings that we have had to forego this year, and I know it isn't easy. My own family's had to make those decisions as well. And so my plea to our community is, please help us. Become a part of the solution. Step up to the plate and do what we need to do for the well-being of our community, not only as citizens, but also as employees of the City of Twin Falls. We've asked you to wear face masks, and we ask you to continue to do so when you're inside of our facilities. Let's be respectful to each other. Let's be kind to each other. Let's show grace to each other. And as always, Twin Falls has found a way to shine and to take care of itself. And I think right now we can step up, we can do what needs to be done, and we can be an example to other communities that need to step up and do the same. So thank you again for having me. And at this time, it's my pleasure to introduce Dr. Fisher from the College of Southern Idaho.
Thank you, Mayor. I appreciate and would echo your comments. So thank you for your wisdom. As the college president here at CSI, I believe it's my highest duty to make sure that the missions of the college are fulfilled. That is to enrich the community, to provide access, and most importantly, to assure that the students that we serve in our 8-county region and beyond have opportunity. And at one very deep and profound level, the response to COVID creates challenges to providing our students and our residents those opportunities. So I would plead to those that are out there in the broader community that we observe and we adhere to the guidelines that have long since been proven over and over: facial covering, distancing, and good hygiene. Those are the effective combatants to this. I look at the screen and I see a variety of community partners, organizations, and individuals that have been collaborating through the pandemic with the college. And I'm actually choosing to try and remove some words from my vocabulary as of late. And one of those is I choose not to use the word flexible anymore. I don't think that my faculty and staff and those in the community are being flexible at this point. I think we're being contortionists. I think that we're trying to move mountains to try and serve people. So I would say thank you for the contorting that I see that we're all doing to try and make this a safe environment. Early this summer, when I was assuming the presidency, I went to breakfast with a local attorney who said to me, "Dean, we've given you the care of one of the most precious things that we've got, the college. Take care of it." Well, I can't do that alone, and my team here can't do that alone. So I ask everyone beyond, let's do the common sense things that we know will work, and let's help each other care for the college and care for the community that we so deeply value. Since the summer, we've been observing all of the protocols as we reopen the campus. Facial coverings are required, physical distancing is expected, and of course we encourage hygiene. But I'm beginning to worry a lot about the emotional health of my students and my faculty and staff, and frankly, those beyond. So I would invite you to go to the CSI YouTube platform, take a look at the way that we've tried to echo that support for each other with our Lean on Me video. We need to do that. We need to do that with each other. And I think sometimes in times of crisis, we all look for things. Comfort foods are predictable, but I also want to echo the wisdom that many of us learned as a child from somebody that I hope every one of my colleagues admires, and that's Mr. Rogers. Mr. Rogers, when I was a boy and I would see scary things in the news, my mother would say to me, "Look for the helpers. You'll always find people who are helping." Everybody I see on this screen represent organizations that are helping. I would just ask that our business leaders and other civic and community leaders, they jump in on that helping so that we can not just get through this, that we can squash COVID. And I appreciate the partner that I'm about to introduce over with the Twin Falls School District. another individual that has been contorting himself, and his team has been doing it as well. I'm going to yield the mic to Dr. Brady Dickinson.
Well, thank you for that introduction, Dr. Fisher, and thank you to everybody for being here and for people that are able to watch this. I want to publicly thank the staff at South Central Public Health, who I talk to very regularly and who always are so great to take my calls and to discuss the situation here in the school district. I also want to thank St. Luke's for the same. I feel like we have really been able to talk and build some team and collaborate as we strive to navigate these challenging circumstances here in Twin Falls. I also want to say thank you to our community because I know that when the schools make decisions in terms of school schedules, it has a dramatic impact on the patrons of our community. And so I understand it's hard on business and it's hard on families when schools have to pivot and change their schedules. And so I just want to say that I know that there are many people that are frustrated with the situation, and we're frustrated as well. We want nothing more than all of our kids back in school every day, and are working really hard to do our part to get the numbers down so that we get all of our kids back in school in face-to-face classrooms every day. Here in Twin Falls, we utilize a plan that was put together this last summer. We spent hundreds of hours building a operational plan to reopen our schools, and it's aligned with the Idaho State Board of Education's back-to-school framework. And so as a school system, we utilize the plan and, again, the guidance from the state in order to determine the operational levels within our school district, and we'll continue to do so in order to make these decisions. What I would say is that to get our schools back to where our kids are in school every day, we need everybody's help. You know, I'm echoing what everybody else on this call has said, but we've got to get our numbers down and provide that support to our hospital so that we can safely have the large gatherings that are necessary. When you start bringing large numbers of people within confined spaces, you're increasing the opportunity and the chances that you're going to see that spread. And so it's just critical that we all continue to do our part to get those numbers down so that we can continue to provide the very best educational experience for our kids. And so, again, I just echo what others have said here, and just know that we're going to continue to do our part to combat this within our community, and we stand ready to partner with all the organizations in our community to be able to support one another during this time and to help each other as we work, as we make these decisions and work together. So again, thank you to our community, and just know that we're all in this together, and we all want to see us return to life back to normal as soon as we can. So with that, I will turn the time over to a couple of chamber folks. It looks like we have Sean Berger and Doug Stokes here with us today. So Sean and Doug, it's all yours.
Muted.
Sean, I'm going to go check on why you might be muted. Let's actually move on in the meantime to Dale Ducommun with the Cliff Bar manager. Dale, can you talk to us for a minute?
Yes, I certainly can. And I just appreciate the opportunity to share a perspective on how the rising rates of COVID-19 are concerned for the two places that I really care about, Cliff Bar Baking Company and the city of Twin Falls. As both a leader of a business and a neighbor, I'm really concerned about the well-being of our community. The strain of the pandemic has placed on the 300 plus people that work at Cliff Bar Baking Company really tells me the current approach we're using is not sustainable. It's hurting our people and it's hurting our business. The financial reality for our company is that we're a employee-owned company where people come first. We've invested in leave and in safety protocols. We require mask usage. We require frequent hand washing and social distancing. And that has made our bakery one of the safest places to work in Idaho. And these investments are working. We have not had any internal spread of COVID within our facility. But we are seeing a spike in COVID positives for our people that are traced to community spread. There are real costs for us in this spike. We've had about 20 people per day on leave in October. That's up about 100% from early in the summer. Over half of our people have had to take leaves, whether it's for testing, possible exposure, childcare, or family care. Our costs for this leave are about $200,000 year to date. Those are just the dollars and cents that we're talking about. There's certainly other impacts that other food companies, other manufacturing companies in the Magic Valley are sharing. People are having to work unexpected hours to fill in for others. There's been a lot of stress for having to care for high-risk family members. And there's also the financial and logistical strains that are put on people that have to navigate childcare or having a spouse out of work. I have a lot of real concerns about what this wave of instability and stress means for our bakery, for our business in general in the months ahead. And I think it's important moving in the holidays that we do everything we can to avoid these ripples, which will intensify if we see business and school closures happen. For me, there's no doubt that what makes this business great is the emphasis on personal responsibility. I do believe that with that comes personal accountability. There's a tricky balance there that we've been able to navigate at the bakery through a set of shared practices and really a commitment to keep each other safe, and that has made our work possible so far. What works in the community may look different than what we can do in a food manufacturing facility, and I leave that to public health officials to decide. But it's the spirit of what we've been doing here at Cliff Bar Baking Company that I want to offer to my neighbors. We've kept our doors open and our jobs protected because we're responsible to one another when we share space. And I'm concerned the community spike will continue to put our essential workers and our community at risk. So finally, I'd like to thank the South Central Public Health District for their leadership and for the opportunity to talk about this and how it impacts our business. And I'll toss it back over to Sean.
Keep talking, Sean. We'll figure this out.
There we go. Can you hear me now? Excellent.
Yes.
I am so sorry. We've all been trying to become audio-visual technicians since March, but apparently I haven't studied enough lately. So once again, I'm Sean Berger. I'm the president and CEO of the Twin Falls Chamber of Commerce, and I want to start off by echoing many of the comments that folks have said here today, thanking the partners who are on this call with us and have helped to try to guide what we have been doing for our constituents in the business community since clear back in March when Governor Little first issued the stay-at-home order. We have tried to be a trusted resource to connect our business members and the business community as a whole to the information and the protocols that they needed to successfully operate, to continue to serve their employees and their customers, and to help to slow the spread of the virus. This has included a lot of personal responsibility that we've talked about, limiting our interactions with others, physical distancing, good hand hygiene, wearing of masks when appropriate. It's also included a lot of protocols implemented by business establishments to help create that safe and healthy environment so that our employees and customers could continue to do what they needed to do. That's frequent sanitizing, physical spacing, mask wearing, shifts to curbside commerce. I look back at those times in May and June when we were slowly reopening business throughout Idaho, and we had a lot of success with it. Our businesses were adaptable, they were resourceful, they were resilient. It was amazing to see, fine white linen tablecloth restaurants convert into curbside pickup delivery services in the span of about 48 hours when we were dealing with this initially. There was a lot of kindness and a real spirit of togetherness. And as we've emerged from that stay-at-home order and continued to reopen, I think we all were in that shared sacrifice mode and really trying to adapt to this change. But we've all become somewhat complacent in this. We are all exhausted with the adapting that we have to do in every aspect of our life every day. Those same practices that we were doing back in April, May, June are as important now, and maybe even more so as they were back then. We need to keep our friends and family and neighbors from contracting the virus, to limit those exposure opportunities so we can make sure that our employees can come to work, our kids can go to school, our customers can be served, and mostly that our healthcare frontline workers can be at the ready for us no matter what our health needs might be. We continue to be a resource here at the Chamber. If you have a business and you're looking for assistance in kinds of things that you might be needing to do, we're here to continue to help with that. And now I'll turn the time over to Doug Stokes, our board chairman from the Chamber.
Thank you, Sean. I'd like to thank all those who have previously addressed us today. I appreciate your words and your perspectives. I'd also like to thank Sean and the other Chamber employees who have worked so hard over these last 7 months to assist businesses and individuals with their needs. It hasn't been easy. In addition to my duties as the chairman of the board of the Chamber, I'm also a local businessman. Now, in serving as the chairman of the board of the Chamber of Commerce, I've been in close communication with many small businesses and business owners in relation to their struggles and successes during the last 7 months. I think that we can all agree that we've been impacted in one way or another during this time. I realize that no one in our community likes to enter into the red phase where restrictions are being placed, and that is especially true with businesses. However, it is imperative that we do what we can and that we control our controllables. This week, my insurance office is short-staffed. I have a team of 6 that works with me, and I'm personally down to 2 out of those 6 employees. The reason for their absences range from potential COVID exposure at home, COVID-19 positive test results, parents who have to stay home with their husbands and their kids who are sick and or potentially out of school, and those just not feeling well with a cold or a flu. And I know that my personal situation is not confined just to me. Many others are feeling the same thing. We know that many wise steps have already been outlined and taken to help individuals and businesses slow the spread, so we can maintain positive in-person learning environments for our children at school, allow them to continue with their extracurricular activities such as athletics, and keep our business doors open. However, teachers and administrations have also done an excellent job at finding creative ways to move forward with learning, and I implore businesses in our business community to not give up hope, but also to find innovative ways, as Sean had stated earlier, in which you can communicate and interact with your clients while helping slow the spread. These may include potential partnerships or outsourcing with other businesses, employees' home-based work environments, adopting new business models, and embracing technology where appropriate. We know that COVID affects us all differently, and for many has minimal impact. However, I will remind our business community that one thing that assisted us in getting through the first few months was the payroll protection program, the PPP money that was part of that stimulus program. We don't know if another stimulus will be coming. We don't know when and what it's going to look like. So I would implore our business community to look for different ways to be able to innovate and continue to keep your doors open. And if you need assistance, please contact Sean and the Chamber employees. It does affect us all by having strained and already overloaded hospital systems, no matter which walk of life you're a part of. If in doing our part releases these pressures that are straining and plaguing our medical systems, we will have made a positive impact. Now, it's been said, how do you eat an elephant? One bite at a time. So I would ask the question, how do we help our medical system from becoming overloaded? By all of us doing our parts, one positive decision at a time. And I will turn the time now over back to Brianna.
Thank you so much, everybody who's participated in this press conference today. We will now open it up to questions. I have received one question so far. This is from Benito Baez with News Radio 1310. He's a question for both Dr. Kern and for Mr. Smalley. Let's start with Dr. Kern. Is St. Luke's, at St. Luke's, how many are sick on staff? Are there enough nurses coming from out of the area to help?
We have requisitions open for traveling nurses. Those are hard to fill because you're seeing spiking COVID numbers all throughout the United States. We have brought in nursing staff from Boise to help backfill some of our gaps in the same way that when they had a big spike in July and their numbers were worse than ours, we helped send staff over there. But yeah, we're filling the gaps, but part of that is by bending on our normal nursing ratios. It is not sustainable. We do have a lot of staff out sick. I don't have the exact number for Magic Valley, but it's considerable. We've been between 4 and 15 nurses short almost every shift.
Thank you, Dr. Kern. Oh, please go ahead.
And say thanks for that question. I don't know our exact numbers either. We have not had to seek nurses from outside our hospital at this point, but we've been at capacity several times in the last few days where we didn't have more nurses that we could bring on to help support additional patients. We've been partnering similar to what Dr. Kern's doing at St. Luke's. We partner with our friends at Intermountain Healthcare with nurses being flexible to be able to come between hospitals. But unfortunately, the hospitals in Salt Lake have been filling up. And so the concern about the ability to flex staff between hospitals is becoming more concerning.
Thank you so much, Mr. Smalley. This is the only question that I've received so far. I'll wait another couple of minutes if anybody among our media reporters are available, or pardon me, have any questions that they would like our available presenters to speak to. Oh, we just got one. This is from Rachel. It doesn't tell me if this is Rachel from Boise State Public Radio or Rachel from KMVT, but she asks Dr. Brady Dickinson, now that Twin Falls is in the red risk level, will you recommend to your board that the school district move to a fully remote schedule? Will there be a board meeting before October 28th?
Yeah, thank you for that question, Rachel. So our board is meeting tomorrow morning to make a determination on our schedule. We're currently looking at lots of factors in terms of what to do. We're considering numbers within the community. We're also looking at rates within our schools. And so tomorrow morning, the board will consider those numbers and look at whether or not they feel the district should continue in a hybrid model or move to a full online model. But what I would say is that, again, we're currently looking at all of the factors that are at play. So the big picture in terms of not only spread within the community, but also spread within the schools. And so that determination will be made tomorrow.
Thank you so much, Dr. Dickinson. I believe that was Rachel from Boise State Public Radio. Another Rachel, I assume Rachel Fabi from KMVT, asks, what can we as the media do to help get this message across? Like you, we've been drilling the basics of washing hands, wearing masks. Now, she hasn't directed this to any one person, so if somebody would like to volunteer.
This is Ben. If you don't mind, I'd love to just offer one thought, and that is, I think there's a lot of power in sharing stories. I think people understand what is being asked and continuing to say, please wash your hands, please wear a mask, please do this, please do that. I think people get that, but what we could use more support on is helping people understand the why. And I think to a certain extent, sometimes we have had a tendency to dehumanize those who have passed away from this or found ways to explain away or justify why it's okay that we've had over 200,000 people in this country pass away from it. And so if the media were to be able to share more stories and examples of those who've been impacted by this, I think that'd be extremely helpful. And then two, I think it would be really helpful to connect what we all want, which is to be able to keep our businesses open, to continue to do elective surgeries and provide services, and to live life as normal as much as possible. That's all what we want to do, and to connect that with these basic efforts of wearing a mask and washing your hands, doing those things is the pathway to allow us to continue to do those things. When we talk about shutting things down or going remote or things like that, that is in part the result of us not following these basic habits that, if we're willing to do, will lead to the ultimate outcome that we would like, right? It's like whether you choose to wake up early in the morning to exercise or not. It's not very fun to wake up earlier. It's easy to sleep in, but if you wake up early and exercise, then you feel good the rest of the day and you get the outcome that you want. If we're willing to wear a mask when we go to the grocery store or choose to limit the size of our social gathering, that may not be fun in the short term, but it will lead to the longer term outcome that we're seeking. I think messages like that would be helpful.
Thank you so much, Mr. Smalley. Would anybody else like to respond to that question? Yes, please, Dr. Fisher.
I would echo the comments, but I think it's also, to me, about preserving opportunity, whether it's preserving a business being open, preserving the economy being robust. To me, it's about assuring that all of the other things that the College of Southern Idaho does, if this doesn't work and we continue to see spiking numbers, every time I try and enrich the community with arts, every time we try and assure that there's the competition in athletics, we have to say no. So if people want life to return to normal, we're going to have to make some short-term sacrifices. So I think the why is that we want to return to normalcy, but we're not going to get there just by hoping and dreaming. We're going to get there by tangible actions. And I think the tangible actions we've always, I think we've always known those are good practices, particularly in a pandemic. But I would just say that it's about getting back to normal, but it's going to take action.
Thank you so much, Dr. Fisher. Mayor Hawkins, did you want to add to that?
I did. One of the other things that I think citizens in Twin Falls want is the service of their city. And if our firefighters and our police officers and our street crews are not physically able to deliver those services, you're going to see other trickle-down effects. We're going into winter. You're going to want your street crews out there removing snow so you can get to where you need to go. We need a healthy team. We need our police and fire to be able to respond to those emergencies. It trickles down all the way around, and we have to keep our staff healthy. And if our community is continuing to spread this disease, it trickles into all those areas. It's not just the luxury items. It's day-to-day life, and it is getting clean drinking water. It is being able to have a sewer system that's functioning. That takes real people to work those jobs as well. And sometimes I think we forget that.
Thank you so much, Mayor Smalley. I'm going to move on from that question because we have several more. I have one question that I think our medical community can answer fairly quickly, and then I have a couple of questions for our elected representatives. Another question from Rachel from KMVT is, for Dr. Kern and Mr. Smalley, have deaths been exaggerated? We often get comments saying, oh, well, I know of someone who had a loved one die in a car crash, but they could put the cause of death as COVID so the hospital can get federal money. Mr. Smalley, can you respond to that first, and then we'll go to Dr. Kern this time?
Sure. Yeah, and I appreciate that question, Rachel. And it's unfortunate that perception is out there. It would be a very big deal to falsify a record, and especially the motivation behind that to get federal money. And so I can say very confidently that there's no motivation or effort on our part, and I would guess every hospital to try and call something COVID where that wasn't the cause of death. And welcome Dr. Kern's input as well.
Yeah, well, I think that case is possible. I think it's very unlikely to be happening at a frequent level. In fact, if you look at the data, for the most part, we're probably dramatically undercounting COVID deaths because we're seeing a lot of complications, including blood clots and myocarditis in patients who had very mild symptoms and maybe didn't even get tested for COVID and then have sudden death or complicated deaths that follow after the infection. Anybody who has filled out a death certificate, which I'm guessing I'm the only one on the call that actually has, would not think that this was a big concern, because you have to really put down what's real. You can't just make it up and put down COVID on a death certificate of somebody who had no evidence of COVID.
Thank you to both of you for your answers. Now we have questions, first for Commissioner Reinke and also for Mayor Suzanne. Commissioner Reinke, if you will answer first. The hospitals have been warning us that the situation was heading toward this point for several weeks and have pleaded for a mask mandate. Why have you not found those pleas compelling enough to impose mask mandates? And will either the county or the city now consider a mandate based on the severity of the situation today? This question is coming from Colin Tiernan from the Times News.
Thank you. First of all, I want to thank all of you on the screen here today for the great effort and the common message that we need to be working together to do a better job of getting this message out. I think Brianna's done an excellent job from the health district. And during our Board of Health meeting yesterday, it was very difficult because of the challenges and the passion from Dr. Kern and those that were on the board meeting yesterday afternoon. I'm really grateful for that. As far as what it's going to take from our standpoint, I've got to work on that with my three commissioners, the two commissioners, so the three of us can be of one mind, and we'll continue to move forward. We want to do what we can from here in Twin Falls County, from our offices, from all the services that we provide, as Mayor Hawkins mentioned. I think her point was well stated, but these services that we have that we provide are critical that we keep moving forward, and we've kept those services available from the very beginning of this process. The mask mandate, I still believe that it's very important that we encourage people to participate in the safety of the three areas we talked about in this press conference today. As far as masks are concerned, it's something that we all need to take to heart to help protect our frontline workers as well as our community members. And it's something that we're going to be working on with much more diligence here at the county level.
Thank you for that question. First of all, to reiterate, as I said earlier, no one city council member can make a decision. It is take a vote of the council to enact anything. With that said, I think it's also important to remember that the COVID numbers we're looking at are county numbers and not just city. We are willing to do our part and come to the table, but again, to put a Band-Aid on a gaping wound isn't going to help. It's going to take the entire community to enforce a mask mandate to make a difference. If you place those mandates on Twin Falls only, people are going to just trickle out to the surrounding areas. We've seen that in Ada County. Everybody started leaving Boise and going to Meridian and Eagle and Cuna and Nampa, and so it didn't have the intended effect. And unfortunately, that would be the same thing with Twin Falls. Even though we might have the largest population of the county, we are not the entire county. We need to be able to structure something that is going to be common sense and really make a difference. We can help create something with the community. And when I talk community, I'm talking Magic Valley. We really need to look Jerome, Kimberly, Buell, Hanson, Filer. I mean, we need total buy-in. Otherwise, we are just going to push this out into those smaller areas and create problems. Plus, it's, you know, common sense again. If you make rules that don't make sense to people, it's harder to get compliance. For example, getting on an airplane, one person at a time down the jetway, but then you get on the plane with the recycled air and everybody takes off their masks and they're eating and talking and whatever. So what have you done besides saying, well, we did something, we made you slow down when you board the plane? It really didn't have any effect. We want to make decisions that are going to make sense and be able to get compliance and get folks to understand that it's a whole picture and it's not something that just happens within Twin Falls city limits. I'm hoping we can get the mayors together. We're working on more of a joint project that can really make an impact, because that is where we're at and that's what we need.
Thank you so much, Mayor. We have several people who are leaving in the next couple of minutes, so I want to ask this next question quickly. And once again, let's start with you, Commissioner Reinke. Within the risk assessment, it says the health district, county, cities can call for stay-at-home orders, mask mandates, business closures. Do the public representatives here see those as useful, appropriate actions at this point, and will they be considered at this point?
I would need to, again, that's an issue for the three commissioners on a local level. As you know, Blaine County has taken that step. They have the freedom to be able to do that. We have not. That has not been the desire of the three commissioners here in Twin Falls County. One of the biggest issues for that is the feeling that it's going to be very, very difficult to enforce, and the challenges of pitting groups of people against each other when you see people that have masks and those that don't, some of those challenges that causes. I think that's a lot where we're coming from. Again, as Mayor Hawkins has indicated, it takes two of the three commissioners to be able to proceed on something of that nature, and it's something that is a much larger issue with all the cities that exist within the county as well.
Thank you so much. Mayor, before you speak, Benito Baez, who asked for that question, actually rescinded it, saying that he did feel like he received a solid answer from your previous answers. One final question for Dr. Kern before he leaves. Doctor, if you don't have enough time, I totally understand. We are very, very close to 4 o'clock. What general services will St. Luke's be cutting back on in the coming week?
More announcements to come on that.
Okay, great. We have a question now for Linda Montgomery. This question comes from Colin Tiernan with the Times News. Linda, he asks, you voted yesterday to write Governor Little asking him to impose a statewide mandate, but voted against the health district imposing its own. Why are you in favor of a mandate if done by the governor, but against it if done by our health district?
Okay, the reason for that vote was we are appointed by our county officials. We are a 9-member board, and all of the communication I've had from the elected officials within the city of Jerome, the county of Jerome, this type of thing, they were concerned about the enforcement. Possibly if it comes from the state level, there will be some funds and assistance in enforcing it.
Okay, thank you. At this point in time, that is all of the questions that I've received. If everybody who does not have other commitments that they need to go to can wait for another minute or two, we'll make sure that all of the questions have been answered. We have an additional 10 minutes of the 30 minutes that we promised to our reporter friends. Oh, and we just got one. This is from Vanessa Grieve over at KMVT. She would like to know, we see comments from parents and citizens about the emotional or psychological toll the tight restrictions, guidelines are having on people, especially as the pandemic persists. Beyond encouraging people to stay the course of keeping up good health practices and not become apathetic, what would you say to those in the community who believe they are reaching a breaking point? She addresses this to the entire group. Is there a volunteer to answer that question? Yes, please. Thank you. Sean.
So this is Sean Berger from the Chamber. You know, I would maybe offer a slight tweak to your question. I don't think it's necessarily the tight restrictions and guidelines that are causing anxiety. It's the virus. I think we have been quick to point fingers at government officials for shutdowns and guidelines of masks making my life miserable. At the end of the day, this is a pandemic. And I think back again to those March, April timeframes when we were all at home. It's a lot of personal stress and psychological impact and anxiety for all of us. And I think what helps us through that was alluded to by many of the speakers today is our togetherness. As a Chamber of Commerce, when we started this, we're a networking organization. That's what we're created to do, to connect people to each other. And in the time when you couldn't be in the same room with each other, we found innovative ways to continue to do that. And I think we need to keep doing that, but it doesn't mean you have to, grab your whole family and go out to the bar and hang out for 3 hours. It means pick up the phone and talk to someone. It means stand out at the end of the sidewalk and talk to someone like we were doing earlier this year. I think it goes back to personal responsibility for all of that, we're weathering a lot of stressors in our lives. And I would just encourage people to continue that kindness and sense of togetherness that I think we all experienced earlier this year.
Thank you so much, Sean. From the health district perspective, Melody Boyer unfortunately just had to leave, but I do also want to mention that we do have quite a few resources for families who are suffering from any kind of behavioral health distress at this point because of the pandemic or for other reasons. If you are not able to find those resources, please reach out to us. We'll get those to you. We've posted quite a few of those on our social media, on our Facebook page, and we will continue to do that. There's a lot of stress right now because of this virus on all aspects of our community, on our medical professionals, on our business professionals, and on our individuals who hold up all other aspects of our community and keep our community moving forward. So there are quite a few resources available to you. Now, I do see that Mayor Hawkins had to leave, Dr. Kern had to leave. I understand that Commissioner Reinke was planning to leave, and I don't know if he has left at this point, but it looks that way. If we have any more questions, we'll take those now. We have another 8 minutes that we've promised to our media partners to answer questions. We still have quite a few people on the call.
Brianna, this is Brady Dickinson. Can I also piggyback real quickly on the last question?
Yes, please do.
I was just going to say, I echo what Sean just said in terms of the anxiety that the stress or the virus causes. I would also like to echo that there are resources within the schools and that teachers and counselors are very aware of the stress that kids are under right now. And then I would say to parents, I think it's really, really important that we're talking to our kids every day about situations and about life. There are hardships that come up in our lives all the time. And I think as adults, this is just a tremendous opportunity for us to wrap our arms around our kids and be able to have these conversations at home about how to deal with situations that are difficult. And so, I just echo what they've said and what everybody has said, and just recognize that it's really challenging for kids right now. And I think as parents, it's just really important that we're talking to our kids and accessing those resources that are available.
Thank you so much. Thank you so much, Dr. Dickinson. I understand that Dr. Fisher now has a comment.
Thank you, Brianna. I would echo Dr. Dickinson's comments as well. And academically, I've studied the concept of leadership quite a bit. And the most effective leaders throughout history have been those that can message hope, but hope with tangible actions. So I think that if we messaged a lot more hope and a little less fear, but couple that with practical steps and the why, we might be more successful in this.
Thank you so much, Doctor. Would anybody else like to answer that question? Okay, great. We have a new question. This is for the district. Could someone from the district explain what actual implications come when you move to red? Because Melody Boyer has left the call, I will do my best to answer this question. Essentially, what it means when we move to red or to our critical risk category is that the data is showing that we have moved into a point where the spread of COVID-19 has critical implications in our community. Now, there are a couple of factors that play into that critical risk category assessment. One is the daily case rate. This is tabulated or collected on a 14-day rolling average to make sure that one single day does not skew the data, but it is a trend that we are looking at whenever we do these assessments. As that daily average climbs, not only are we looking at more cases within our community, but we're looking at a higher impact on public health's ability to follow up on those cases with investigation and close contacting, which means that our investigation of the disease is severely impacted. Now, other factors that we look at include positivity rate, which can also help us understand how many people are actually testing positive when they test. As that positivity rate rises, it implies that more people who are being tested, of course, are testing positive, and therefore there is more spread within the community. The limitation there is if few people are testing, that may be that the testing is restricted to people who likely have the disease. Right now, our state numbers are showing that testing is up and positivity rate is up, which does tell us that there is quite a bit more spread of this disease in our communities. The other big metric, of course, is hospital impact, which our doctors have spoken with and our hospital administrators have spoken toward today. Now, the implications of a red or critical category by those metrics indicate to us that the disease is spreading, and those who are most vulnerable in our community are not only at higher risk of severe consequences or even death, but as our businesses have spoken to today, the very aspects of our communities that we rely on to continue our day-to-day actions and life are impacted as well. Our Commissioner Ranke and also our Mayor Hawkins has also spoken to that. So when South Central Public Health District puts all of this data together, it's not just a collection of numbers that we're looking at. It really is a reflection of how pervasive this disease is in our community and likely what the effects or how many people, in fact, are being affected by that disease. Please definitely follow up if that wasn't a sufficient answer. And we do have another question. This is from Benito. He is wondering, Mr. Smalley, if you can answer this, are resources at adequate levels right now for PPE, ventilators, et cetera?
Yeah, thanks for that question. So that has been a really good thing for us spiking later on in this pandemic is we have a high level of confidence in adequate supplies and PPE and ventilators, et cetera. We've had time to catch up and prepare, and so we feel really good about that, and we've appreciated all the donations that we've received to ensure that we can protect our patients and protect our caregivers.
Thank you so much, Mr. Smalley. From the health district perspective, we have helped to coordinate PPE to facilities, to organizations that require it and are unable to access it. There is quite a resource of PPE that has come down from the state, from Idaho Health and Welfare, and from the Office of Emergency Management that we have helped to distribute to various organizations that require it for their day-to-day operations. With that in mind, as we continue to see more outbreaks in our long-term care facilities and our other congregate living facilities, the strain on that PPE, personal protective equipment, becomes more and more severe. The requests for that become more and more severe. The way that PPE works, people have to put it on and take it off with every new patient. So when you are going from room to room, helping some of these people who live in congregate living facilities, you can drain your resource of PPE very quickly. Now, at this point, the resources are standing up, but that is another very good reason to be careful in our community to take action now, because if we do start to dwindle in supply, the likelihood of spreading that disease in these facilities where our most vulnerable often live definitely increases. Now, that is, once again, all of the questions that I have at this point. That's also, not quite, we still have 2 more minutes. If you have any additional questions, please drop them in the comments right now in the chat box, and I will get them to the appropriate person.
Brianna?
Please go ahead.
On behalf of the South Central District Board of Directors, I would like to thank the community members that have joined us today on this and commend you and the staff at the Health District for the work that you do and you continue to do. Together, all of us joining, encouraging people to wear masks, social distance, follow the recommendations, we will overcome this. It will take time, but we shall succeed.